For the first time in about 20 years, patients have access to a new cancer detection tool, 3D mammography. Today, we've asked Dr. Danielle Wellman to join us to explain the difference between a 2D and a 3D mammogram. Dr. Wellman is a breast imaging specialist at Wake Radiology. Dr. Wellman, thank you for joining us today.
You're welcome.
So basically, what is the difference between a 2D mammogram, which is a traditional mammogram, and a 3D mammogram?
So a 3D mammogram is used in conjunction with your 2D mammogram. So you're actually taken together. So your 2D picture is taken, the traditional mammogram like you're used to getting, and then the machine now moves over your breast in an arc, takes multiple pictures as it's moving over your breast. And a computer takes all those pictures and it generates a 3D picture of your breast.
Okay.
And the radiologist can now go through that and flip through those pictures like pages in a book. And so it's much better look at your breast than trying to look through the entire book like a 2D mammogram.
What is the patient experience? Does it take longer? Does it hurt? Is it less compression?
So it should be about the same as the traditional mammogram.
Okay.
Patients really don't notice that much of a difference other than the small amount of time that machine moves over your breast. But otherwise it's basically the same as a 2D mammogram.
Okay. We spoke earlier with Dr. Carrie Chandler about dense breast tissue. Is this an important tool to utilize for those ladies who have been diagnosed with dense breast tissue?
So it is helpful in seeing the breasts in patients with dense breast tissue, but it has also shown significant improved cancer detection in women of all breast densities. So we recommend it for all of our patients.
Okay. If I wanted to schedule a 3D mammogram for myself, do I need an order from my physician?
You can just schedule it like you would a normal 2D mammogram or traditional mammogram, and just make sure you tell the schedulers that you want a 3D mammogram, and they'll make sure you're doing it in a spot where they have the 3D mammograms, because we only have a few spots that have those right now. And if you're already scheduled for a traditional mammogram, then make sure you call and tell them that you want a 3D mammogram so they can make sure you're in the right slot for that.
Okay. Is there an additional cost for a 3D mammogram?
Since it's such a new technique, all insurance companies aren't reimbursing this yet. Traditional part of the mammogram will be reimbursed fully like it has been traditionally, but there will be a small fee due when you arrive if your insurance isn't reimbursing.
Why is a 3D mammogram better than a traditional mammogram?
So the 3D mammogram has been shown to have significantly improved cancer detection.
Okay.
So we see more of the invasive cancers with 3D mammogram, the cancers that are more important to catch early. And we catch them when they're smaller in the studies that they've done so far. So that when they catch them when they're smaller, they respond better and the patients have a better prognosis. So that's what we want to catch them. And we also see less of those recalls where the patients are called back to investigate a questionable area in your traditional mammogram. 3D mammogram helps us see through the tissue, so there's less of those questionable areas and less of those callbacks that cause patient anxiety.
Exactly. Dr. Wellman, thank you for joining us today.
You're welcome.
To learn more about the topics that Dr. Wellman discussed or to schedule your yearly screening mammogram, visit us on the web at wakerad.com.